Diaphragmatic and thoracic endometriosis, it seems to be a lot more common than it's actually being made out to be. So things like cyclical symptoms of chest pain, breathlessness, pneumothorax, rib pain, shoulder tip pain, blood and sputum, chest infections, and even the upper abdominal digestive symptoms, which is what I had. Diaphragmatic and thoracic endometriosis seems to be notoriously difficult to detect, and so many women end up in A&E when they bleed, and they're typically sent for an X-ray. And they say it comes back negative and they're just sent home, and this just repeats. It's even more difficult than with pelvic endo because we're lacking, it seems, the thoracic specialists. Then there's the surgery risk. So I understand that not all women are going to be thrust into surgery because it's more complicated than a pelvic laparoscopy. What are the best ways to diagnose it, to diagnose diaphragmatic and thoracic endo, and what are a patient's treatment options?
Okay, good question. Yeah, so we do see a lot of patients with confirmed diaphragmatic endometriosis. They normally present with a pile of normal ECGs, electrocardiograms, because they have periods, they have chest pain, they go to A&E with chest pain by ambulance, thinking they have a heart attack. They do ECG and send them home with a negative normal report. So these kind of patients, and the patient with catamenial pneumothorax also we see. And the tricky part with thoracic endometriosis, it's not very often seen on the MRI scan. So maybe less than 20-25% of the cases confirmed diaphragmatic endo we see on the MRI scan.
Wow.
Typically, these patients will have pelvic disease. And if they're symptomatic for the chest or diaphragmatic endometriosis, it depends what type of job we need to do in the pelvis. For example, if we just do excision, then we definitely look at the diaphragm as part of a routine sort of pelvic survey, okay, pelvic abdominal survey. If we see the infiltrating diaphragmatic endo with negative MRI scan, then we try and not to treat it if, for example, we have to treat bowel endometriosis at the same time. So a lot of our patients will have severe pelvic disease, which is treated as a stage 1, and then we move for thoracic endometriosis, for diaphragmatic endometriosis as stage 2. And we use both abdominal approach and we use thoracic approach with thoracoscopy to treat thoracic and diaphragmatic endometriosis. And again, this is totally MDT based service, right? So we have hepatobiliary service in our center, we have thoracic service. They're mostly cancer specialists, right? But they have special knowledge of endometriosis and they know how to do a very economical but yet radical excision of diaphragmatic endo and the endo in the lungs.